So basically what we're going to do is we're going to go over the new nursing care rules that went into effect as of October 1, okay? They're actually on our website now, so if you want to pull them. Our new rules now are under Article 4 instead of Article 9, all right? And if you may have noticed, we're going to go through some of the definitions, but most of our definitions have been moved out of our own rules and put in what we call Article 1. You've been provided with a copy of Article 1 and Article 4 from the back, but you can get them both online, okay? You go under the nursing care rules, all right, for it. So a few things I wanted to go over with you is regarding the definitions, okay? And I'm going to read these kind of verbatim because these are actually our definitions now for the Bureau of Long-Term Care, and these are specific to our Bureau. And basically, behavioral care, and this is a new definition for us, we never had this before, is assistance with residents' psychosocial interactions to manage the residents' behavior that can be performed by an individual without professional skills, and that may include direction provided by a behavioral health professional and medication ordered by a medical practitioner or a behavioral health professional. Okay? Included with behavioral care is what we call behavioral health services. And basically, with those underneath behavioral care, it means that behavioral health professional is provided on an intermittent basis to address the resident's significant psychosocial behavior response to identified stressor. Again, this is under behavioral care, all right? All right, and a definition for care plans for long-term care is it means a documented description of medical services, nursing services, and health-related services and ancillary services expected to be provided to a resident based on the resident's comprehensive assessment that includes measurable objectives and the method for meeting those objectives. Okay? Okay, intermediate. Basically, now with our behavioral health, it says that you can provide it on an intermittent, basis instead of intermediate. Intermediate means basically not on a regular basis. When it comes to behavioral care, they didn't provide us direction on what the definition of intermediate was going to be, whether it means that you could provide professional behavioral health for 3 months, 2 months, or 4 months. We don't know that yet, and we're waiting for a little clarification. But just for intermediate means for right now is just not on a regular basis. Okay? And this is going to be informal. If you have any questions, please let me know, and we'd like to answer them as we go. Okay? All right. Resident means a patient admitted into a nursing care institute with the expectation that the resident will be present in the nursing care institute for more than 24 hours. Okay?
Can I ask you a question?
Sure.
Your definition of care plan, it's here, it's different from what was up on the board. Sure. Which is this more current, or is that more current?
You know what? Just 1 second here, and we'll have to look at that. Question was the care plan definition different from what we provided? Means a little bit different. Let me 1 second. Shirley, do you have we'll have Shirley look at it. The definition for care plan? Yeah.
Article 4 means a documented description of physical health services and behavioral health services expected to be provided to a resident based on the resident's comprehensive assessment that includes measurable objectives and methods for meeting the objectives.
Those have had ancillary services or
Medical services.
Our medical services. The other one would probably, the one that's on that will probably be the one we'll be using. Yes, the one actually printed and on the website will be the one we'll use.
Okay.
Okay? Thank you. And we will change the PowerPoint so it actually matches that definition. So when you go back and look into the PowerPoint on the web line, you'll actually see that. We've had multiple changes as we've been going on, and we're trying to keep it as updated as possible. The rules that are online currently and the rules that are on the back are the most updated. We thought we had this updated too, but We're working on it. Okay. All right. So we'll go forward. Okay, secured means the use of a method of device or structure that prevents a resident from leaving an area of the Nursing Care Institute premises or alerts the personnel member of the resident's departure from the Nursing Care Institute. Okay. Now the rest of this is basically going to be what is new. If it really hasn't changed or if the definition hasn't changed, we won't be presenting it. Okay. Okay, ventilator. Basically means a device designed to provide the resident who is physically unable to breathe or who's breathing insufficiently the mechanism of breathing by mechanical moving breathable air into and out of the resident's lungs. Okay. All right. On the application, okay, behavioral health has been added to this. When you talk about supplemental applications, if you're actually, when you're applying for this, there's been a little clarification we need to let you guys know about, we've submitted for. It actually just says on the initial application that you are to check these areas: dialysis, radiology, nutrition, and behavioral health. Okay. We asked, because in the old rules it also said for the renewal application too, because most facilities say we're not doing an initial license, we are renewing our license. So currently the direction has been given is to please, if you were going to be providing these services, please check the box of the services you will be providing. Okay. Also on dialysis, it means that if you're going to be providing dialysis in your facility, it doesn't mean your staff has to be providing the dialysis. It just means if it's going to be in your facility. So if you have a separate unit that is done by contracted service, okay, you still need to check that box for dialysis, because we're wanting to know what kind of care is actually being provided in your facility. Okay. All right. And basically, you also have to check if you're going to be requesting authorization to operate a nutrition and feeding assistance training program. Okay, and you have to be in compliance with the rules and regulations. And believe it or not, most of those, the format on what you actually have to turn in is in Article 1, and we've actually gave you the rule in the area with the information that you're going to need to basically supply us with, okay, for getting that. All right. The process for this is basically, if when you turn in you want the nutrition feeding program, we basically will have a turnaround of about 30 days for you. Okay, that's if everything has been included. If you submit all the documentation required for you to be providing this, the turnaround should be 30 days. If you don't submit, or if there's missing, we will send you a letter regarding what information is missing. Okay, then you will need to send that back. The clock actually stops when we find that the packet has been incomplete. We ask you for the information. If it's not submitted to us within 60 days, then it will actually stop the process. Okay. Okay. All right. Basically, administration, you have to establish in writing the institute's scope of service. Okay. What kind of care is going to be providing in the facility. All right. And designate in writing a Nursing Care Institute's administrator. Okay. That's a licensed administrator, of course. Okay. All right. All right. This is something kind of new for everyone. It's basically if the administrator is going to be not expected to be there for more than 30 days. So let's say they won a grand prize. They're going to Hawaii for 32 days. Okay. We all want to go there. All right. Right. And they're not going to be there. All right. They have to appoint a licensed administrator in their absence. Okay. Now the next one is basically if they're not going to be in the Nursing Care Institute, okay, for more than 30 days, they have to. So let's say they were in Hawaii and they had a scuba diving accident and broke their leg. Okay. And they were going to be in the building. They expected to be out for 2 weeks, but it's actually taking longer for them to heal. Okay. And it's coming up on the 28th day. If they're going to be gone for 30 days, we need to know the licensed administrator who will be in charge of the building. Okay? All right. And basically, the administrator is directly accountable to the governing authority for, of the Nursing Care Institute for the daily operations of a nursing home. Really not much changed on that. Okay? All right, except as provided in the provision, designate, and that was for the absentee and the vacation, designate an individual in writing who is available and accountable for the Nursing Care Institute when the administrator is not present in the building. So, you know, we can come in to do surveys any day, any time, right? And if we came in at 2 o'clock in the morning, we need to know who is in charge of the building. Hopefully, as an administrator, you wouldn't have to be there at 2 o'clock in the morning, but we would need to know who would be in charge of the building, and that's basically who you would designate, okay? And people have asked, does it have to be a specific name of a person? Well, you know what? It's got to be your policy and procedure on how you designate. You can determine. People have asked, well, can it be the charge nurse on station, so-and-so? That is, if that's what your policy is, if they're going to be in charge of the building, that's fine, okay? All right. The administrator ensures that the Nursing Care Institute complies with the requirements if you're doing the paid feeding, I'm going to say paid feeding assistance because that's the way it's always been. It's new for us. The nutritional assistance training program. Okay, again, the requirements for that, there's the information to submit is in Article 1, and then most of the other training stuff is in Article 4. Okay?
Okay.
Yes.
So, designating the individual in writing, does that need to be posted in a conspicuous place, or is that?
No, when you actually submit your documentation, you have to designate, are you talking about the paid feeding, or are you talking about the administrator?
The designating an individual in writing was available, you know, that charge.
Oh, yes. Does that have to be? You know.
Does it have to be in a conspicuous place, posted?
So does the administrator have to be, the documentation have to be posted for who's in charge of the building? There is no requirement for that, but someone, when we walk into the building, someone would have to know who is responsible and be able to inform the staff, or our staff, or whoever would want to speak to who's in charge of the building. There's no requirement that it has to be posted anywhere in our rules currently.
It has to be written available.
It's got to be written and available. Okay. But there's nothing that says it has to be posted. Okay. All right. Okay. All right. Another little bit of a change here is basically the policies and procedures. You're going to see that there's been a lot of changes in administration and in personnel, so these will take a little bit longer. Okay. Policies and procedures are established, documented, and implemented regarding job descriptions, duties, qualifications, including required skills, knowledge, education, experience for personnel members, employees, volunteers, and students. Okay? All right. Yes?
When you are referring to students, are you referring to students that are in a program that is run by the facility, so they are employed by the facility? Or are you talking about any students who might do a clinical in the nursing facility that stay there in a college program and they're coming over to do their clinicals, not employed by the facility?
Okay, are we, when we're talking about students, are we referring to students that are actually going to be employed, that are participating in a program taught by the facility, or are we talking about students that are basically employed like in another school program, a community college, or anything like that? Sorry, I have to repeat the questions for the audience. Okay. We're actually waiting for a little bit of clarification on that. When we interpreted it for the individual students that were going to be employees that were actually taught by the facility. But we were actually waiting for some clarification to determine whether the community college students that have to come in and teach or be taught, or their clinicals there on site, would be included or not. We are continuing to wait for a little bit of clarification. I know they're supposed to be meeting sometime this week and hopefully providing a little bit more clarification for us. So as of right now, I can't answer that. They told us a student is a student at the moment. So, and again, remember, we will be providing technical assistance out there for a little while because this is going to be learning, both not for the providers and for our surveyors, okay? This is a new thing, and it's only been in effect for a little while, and we didn't survey for 2 weeks, so we really haven't been surveying to this or providing technical assistance till actually this week, okay? If there's any questions you have, please call and ask. We'd be glad to put that down for clarification if we can't help you at that moment, but we try to help you as much as we can, okay? Our focus right now is on for the health and safety. If it doesn't go to like an immediate jeopardy or a harm, we would like to provide guidance in the beginning, okay, our technical assistance. Yes, Sylvia?
Another clarification on an issue like students. I would presume that it would be very difficult for facilities to have access to the entire personnel records, including all this information of somebody who is just coming into their facility to do a clinical review. Is this an area that if our facilities had concerns about, that they could put on the Survey Monkey online to make comments about?
So the question is basically if the facilities had concerns regarding getting the information from the students from like the community college, if they could put a comment on the online on the Survey Monkey. Yes, any questions, any comments on the Survey Monkey, you can use that at any time you want. It's open until January 30th. You can go online, okay, and actually put in any comments or questions you have regarding any of the rules. Okay? Okay. Again, policy and procedures that cover orientation, in-service education for personnel, staff members, volunteers, and students, including how personnel may submit a complaint related to resident care. Okay? Now, you may notice we no longer require 12 hours of in-service. What we used to have on there that they had to have 12 hours, it's going to be up to the facility to determine that. Okay? What is required. And we'll get a little bit more into that when we get into personnel. Okay? All right. CPR. Again, the facility needs to determine what staff members are required to be CPR certified. Okay? The method and content of the CPR training and the qualifications of the individual who will be providing that training. Okay? Again, up to the facility and your policy and procedures. Okay? The time frame for renewal of CPR, we know that our cards are usually good for how long? 2 years. But a lot of healthcare institutes say it's only good for 1, right? Okay, so it's up to you, again, the facility, their policy and procedures to determine if it's going to be 1 or 2 years. Okay? Documentation that verifies the individual has received CPR training. So if you're providing it, you're requiring it, you're going to have that documentation. Okay? And first aid. All right? Determine what staff members who are going to require first aid and what are not. Okay? People ask, why would you want first aid training in nursing home? And when one of the sessions we taught, they said, what about the van driver who's alone with the resident in a van, okay, who's driving them? So, you know, facilities need to determine if they want that taught or if they do not want that taught. And if they do, who needs to receive that training? Okay? All right. All right. Training also includes a method to identify our policy and procedures, a method to identify a resident to ensure that the resident receives physical health and service and behavioral services as ordered. Okay? So how is the facility going to identify the residents? Via pictures, ID bands. Okay? Cover residents' rights, including assisting a resident who does not speak English or who has a disability to be aware of their rights. Cover specific steps and deadlines for a resident to file a complaint. I just want to let you know we do have clarification. This used to say, and then how soon, basically, it was deadlines for them to file a complaint and for the facility to resolve that complaint. That portion had been removed, but the deadline verbiage has not. So we do have that out for clarification, because we do not have a deadline for a resident to file a complaint. Okay, so I don't know where that's going to go. I'm assuming they might just remove deadline for. Okay, and then Nursing Care Institute to respond to the resident's complaint, and for Nursing Care Institute to obtain documentation for fingerprint clearance if applicable. Okay. All right, policies and procedures that cover healthcare directives, cover medical records, including electronic medical records, cover quality management program, including incident reports, supporting documentation, and contracted services. Policy procedures that cover fees and refunding, cover misappropriation of resident property, and when an individual may visit a resident in a nursing care institute. Just remember, if you are Medicare and Medicaid certified, you still have to meet those requirements regarding visitation too. Okay. All right. An administrator shall ensure that policies and procedures for healthcare services, behavioral health, are established and documented that cover resident screening, admission, transport, transfer, discharge planning, and discharge. Okay. Cover provision of health services and behavioral health services, including when general consent and informed consent must be obtained or is required, and cover restraints, the order for that, including the frequency of monitoring and assessing the restraint. Okay. Again, these are all policies and procedures. Okay. Policy and procedure that covers seclusion for a resident, including the requirement for an order, the frequency for monitoring and assessing a resident's seclusion, covering telemedicine, and other environmental services that affect the resident's care. Okay. All right. Policies and procedures are available to your personnel staff members, employees, volunteers, and to students. Okay. Unless otherwise stated, information is provided to DHS within 2 hours of request. Okay, and basically, if we're requiring documentation from the facility, the documentation, if we're not on site, basically, we're out on survey with you. We usually give you, 24 hours to provide any other supplemental information back to the facility. If you're going to provide that, you actually have to provide it to the Bureau. You couldn't provide it to, like, assisted living, okay? So it's basically saying get the information to us. Or if you call us with an intake and we ask for some supplemental documentation, just make sure you're sending it to the fax number of the Bureau instead of assisted living, behavioral health, or medical facilities, okay? All right, basically, administrators shall ensure medical services, nursing services, health-related services, behavioral health services, and ancillary services are provided to only a resident. People ask, why do you have that one? Basically, there were some facilities in rural areas that were giving some kind of like health screens out to some of the people who lived in the community, okay? They wanted just to make sure that the services were only going to be provided to the residents in the facility. Yes, sir.
Okay, are you saying that a facility could not provide a free blood pressure screening service to the community?
The question was, could we provide a facility provide free blood pressure screening to residents in the community? As of currently, you're only to provide services to residents that actually reside in your building. Okay.
Okay, once again, if facilities disagreed with that and they wanted to comment on it.
If facilities wanted to, if disagreed with that, and they wanted to go online, yes, they could always put that in there on SurveyMonkey. Okay.
What section is it fall under? The number, one that you just said?
It's under administration. Okay. Abuse, neglect, and exploitation. This is a little bit different because we're talking about, in this aspect of it, is if it occurs before a resident is actually a resident in your building or while the resident is not on your premises. So let's say they have a leave, okay, and they're going to go with their family for a few days over a holiday, okay? If you suspect that abuse, okay, or neglect occurred to those residents, okay, and this is before they're a resident or when they were outside of the facility, okay, you still need to report it according to the Arizona Revised Statutes, which is to a peace officer, which is a police officer or APS, okay? Okay. If abuse or exploitation of a resident is alleged or suspected to have occurred on the premises while the resident is a resident, okay, the facility must take immediate action to stop the alleged suspected abuse or neglect, immediately report the alleged suspected abuse or neglect, and again, that's to what? APS or the police, okay? Document the action taken to stop abuse, and they must maintain that. You must maintain that in your facility for 12 months. Okay? All right. The investigation into it. Investigate the alleged suspected abuse or exploitation and develop a written report of the investigation within 48 hours after the report as required. Excuse me. The information that's required in this is the date, time, description of the alleged or suspected abuse. Okay. Description, you have a question, Terry?
Yeah, so that's changed from the 5 days down to 48 hours. We're supposed to
Currently,
file
yes.
a report.
No, you're not supposed to reply it yet. That's 10 days. You're supposed to have your investigation.
Develop a written report of
Right.
the investigation within 48 hours?
Correct. But that's not supplied to us yet. The supply to us is for 10 days. Yeah. Yes, it did change. We do have a question now for that because when we did have our meetings, they actually said they were going to change that to 5 days. And it didn't get it in this revision. So that is something out for clarification within 48 hours. The other thing is if you go by this, basically you do not have to call or inform us if you go by your state rules until 10 days until your report is completed. And that's 10 days after the event. Again, remember if you're Medicare or Medicaid certified, you still would have to follow those requirements. Okay? But that part is out for a little clarification. Okay? But what was included in that is the description of the injury, names of witnesses alleged, action taken by the administrator to prevent any further abuse or neglect, submit a copy of the investigation report to the department within 10 working days. Okay? And working days is Monday through Friday, 8 to 5. It's been defined. Okay? And it used to be calendar days we know. And then maintain a copy of the investigative report for at least 12 months after the date. Okay? I just want to caution you, if you know our windows, and sometimes we can go out to, on the CMS side for the 15.9, the state says that you can have them for 12 months. I just want to let you know that if we do come in for investigation, we usually look at information from the time frame of the last survey to the new survey. Okay? Yes?
I just want to be really clear on this.
Uh-huh.
So what you're saying is that the initiation of the written report has to take place within 48 hours. Do we still need to call it in to you within the 24 hours of the incident taking place?
Okay, that one is a federal requirement. There is no longer a state requirement for you to call it in. These rules do not have a state requirement that requires a facility to call in an incident within 48 hours or 5 days. Okay? Basically, the new requirement only requires a facility to submit a report within 10 days.
Okay.
The requirement does require that the facility notify a peace officer immediately, basically. And that would be the APS, or the police. Okay, now CMS is different. Those rules have not changed and they will stay the same. Okay, so if you're Medicare or Medicaid certified, please continue to follow those rules. Yes, Sylvia?
When the references here for a resident 18 years of age or older,
Mm-hmm.
the first revised statute is to APS. And then when it talks about 18 years or younger, that's to CPS.
CPS, correct. The first one, basically, if we're 18 years or older, would always be Adult Protective Services. And if you had residents in your facility, and we have one that I know of that has residents that are younger than 18, it would be CPS.
It doesn't say the police.
If you read the revised statute, it says a peace officer, and it goes further on down, and it could say a police officer or an APS officer. Okay? You just have to read towards the middle of the body. Okay. All right, so let's get back. We're going to talk about what's got to be included in that investigation, okay? You basically have to describe the injury, all right? And any changes in the resident's physical, cognitive, or functional or emotional condition, names of any witnesses, and actions taken by the administrator. Okay, a little recap there. And submit it within 10 working days. Maintain a copy for 12 months. Okay. All right. An administrator shall ensure that monthly schedule of recreational activities for a resident is developed, documented, and implemented, and conspicuously posted on the premises. Okay. Administrators shall ensure that one of the following is conspicuously posted. Okay. Basically, the current licensing survey report. Okay. And any information, of course, the resident's name's redacted. All right. And any subsequent reports from the department. Now you can either post that or you can post a sign saying where they can obtain that information. Okay. All right. Administrators shall provide written notification, okay, to the office if the resident's death is required to be reported according to the Arizona Revised Statute within 1 working day after the resident's death. So the Revised Statute basically says that if it was due to violence, or if it was suspicious, or if they weren't under the direction of a healthcare provider, or if the body was unidentifiable, and etc. So if it is a medical examiner's case, best to call us. Now, people have asked us, well, what if the family wanted an autopsy? Okay, is that a medical examiner's case? Well, no, because it's what? It's a request. The family's going to pay for it. It didn't happen under suspicion. You would not have had to report it. Then no, you won't have to call us. Does that make sense? So if it is going to be a medical examiner's case, you call it. They say wait, and all that good stuff. Then you will need to call us. When in doubt, it's a quick phone call. You can just call us if you need to and ask for clarification. I always say if it takes 5 minutes, it's easier to do it and make sure it's done than not. Okay. All right. Within 2 working days after a resident inflicts self-injury that requires immediate intervention by emergency medical services or provider. Now we do have this one out for clarification also. Okay. Some facilities are saying, well, what if my medical director or what if that resident's physician was in there and let's say they cut themselves and they did butterflies or sutures or whatever on site and then ordered x-rays, labs, and everything else while the resident was in the building. Is that emergency? Well, technically it could be. So we've asked for a little clarification, whether that means if they're going to be 911 out and sent to the emergency room, or does that mean if the medical provider comes in and actually provides that? So we're actually waiting for clarification on that one. Okay? All right. All right. Quality management. All right. A plan is established, documented, and implemented of ongoing QA with a minimum, okay? It includes frequency of submitting documentation, okay, required to the facility's governing authority. Okay? The documentation that is submitted to the governing authority it includes, basically, the identification of each concern, okay, about the delivery of services provided by the facility, okay, related to resident care, and any changes made or actions taken as a result of the identification of the concern about the delivery of services related to the resident's care. Okay, the reports and the submitted supporting documentation for these reports are maintained for at least 12 months from the date that the report was submitted to the QA, or the governing authority. Okay. All right, contracted services, really nothing has changed. Personnel. Remember I said this is the second area that has actually changed, okay? And this is a lot, all right? Administrators shall ensure behavioral health technicians are at least 21 years age and paraprofessionals are at least 21 age, and it's behavioral health, okay? Administrators shall ensure that the qualifications, skills, knowledge required for each of the personnel staff member are based on the type of physical or behavioral services expected to be provided by that personnel staff member according to their job description, the acuity of the residents receiving the physical or behavioral health services from the personnel staff member according to established job description. Okay? Again, this is the facility's job description for each one of these. Okay? All right? The type and duration of experience that may allow that personnel member to acquire the specific skills and knowledge for that personnel member to provide the expected physical or behavioral services listed on their job description. Includes the specific skills and knowledge necessary for that personnel member to provide the expected physical health services and behavioral health services listed in their job description. The type and duration of education that may allow that personnel member to acquire the specific skills and knowledge for that personnel member to provide the expected physical health services or behavioral health services listed again and established again in their job description. Yes, Sylvia.
Okay, when we're talking about this whole section, this B, is this including nurses, CNAs, social workers, dietary staff, basically any personnel member?
Yes, it says basically the type based on the physical or behavioral health services expected to be provided, the qualifications, skills, knowledge required for each type of personnel members. It doesn't specify nursing only, it says each type. Okay, so
that would include social services.
And dietary and housekeeping.
it says
Include
each
every single
each type.
job description you have in the building is going to have to be revised to reflect it.
Each
At least
type.
that's my interpretation.
That's our interpretation because it says each type of personnel member, and then it gives some basics based on what they would be doing. Okay, we can ask for clarification. I haven't had that question before. It doesn't specifically list out every job title. It doesn't say LPN, RN, or social services or anything. It just says each type of personnel member.
My question will relate to some about doing this. I have no problem with this at all.
Oh, okay.
It's a great thing. It just
Related back to social services.
something social services later. Why we would have to specifically have all kinds of other things for social services when this particular rule would govern what people provide social services.
Okay. So you will have a question back when we talk about social services in a few minutes. Okay. All right. You're welcome. Okay. We talked about experience, skills, education. All right. Personnel member skills and knowledge are verified and documented before that personnel member provides physical health services and behavioral health services. Okay. And then according to, again, the facilities, policies, and procedures. Yes, Terry.
What kind of verification of a member's skills and knowledge will you guys be looking for?
Okay, what kind of verification of staff or employees' skills and knowledge will we be looking for? It's basically going to be based on we're going to look at, so something easy for me to do is, if you said the staff member has to have CPR training, we're going to go back and we're going to look in their personnel record when we pull, remember we always pull what? A little sample. So we would pull a sample of records and we would be looking to see, like I said, for CPR would be easiest one. We'd look to see if you used required, let's say the CNAs to have it, we'd look in their personnel record to see if there's documentation that you did do that and if it was in there. Or if you were doing nursing skills, if you were doing whatever med pass or medication administration, we'd be looking for documentation. How you exactly document that is up to the facility and according to your policy procedures, but we would have to have verification in there. Some facilities wanted to know if they could do it on in-services. Again, that's fine. We're not going to have a problem with that. You'll just have to have that documentation to be able to supply to the office. Yes?
So you're saying having the licensure isn't enough? A copy of an RN's license or a copy of CNA's license, you would have to go beyond that?
Basically, it's going to be, again, according to the facility's policy and procedure. And then you're going to have to verify. It says a personnel staff skills and knowledge are verified and documented. So that would be the facility's responsibility to verify and document their skills before that personnel member provides the physical or behavioral health. Okay. Yes. It puts a lot back onto the facility, and it'll be a lot according to the policies and procedures.
Only if we require that in our own policies and procedures.
Right, and that would be CPR. But if you're going to have a nurse, who's passing medications, you're going to have to verify that their skills and knowledge, that they're competent and able to do that before they provide.
The license doesn't provide that.
It says you have to verify the documentation.
Verifies the key.
That's verified by their diploma, and the curriculum for nursing is standardized throughout the state. If the person doesn't have those skills, they can't graduate and get the license.
Yeah,
So
that's my point.
Yeah.
They've got a license.
It basically says a facility must verify and document. If you do have a concern about that, please use SurveyMonkey for that, to verify the question. Okay. All right. Okay. All right. Personnel members present in the Nursing Care Institute premises with the qualifications, skills, and knowledge necessary to provide the services in Nursing Care Institute's scope of service, okay, meet the needs of the resident, and ensure the health and safety of the resident. Okay. Okay. Administrators shall ensure that an individual who is licensed baccalaureate social worker, master's social worker, associate marriage or family therapist, associate counselor, or associate substance abuse counselor is under the direct supervision as defined, and that's a behavioral health professional. I will let you know, this actually came out of behavioral health rules. This is under clarification because only under behavioral health is a social worker required to work underneath the direct supervision. So we do have this one out for clarification because if your facility is not providing behavioral health, does your social worker have to work underneath the direction of a behavioral health professional? They have not in the past, so we're still waiting for clarification because this again was from behavioral health. Okay. All right. Administrator shall ensure that a personnel member or employee or volunteer that has or is expected to have direct interaction with a resident for more than 8 hours, okay, meets the requirement as evidenced from freedom from TB, okay? So if you have a volunteer that comes in and they're in there less than 8 hours a week, they're not required to have TB clearance, okay? All right. Basically ensure personnel records is maintained for an employee, volunteer, or student that contains the individual's name, date of birth, home address, and contact telephone number. Individual start date, okay, if it's employment or volunteer, and the end date if applicable. Okay, document the the individual's qualification, including skills and knowledge applicable to the individual's job duties. Okay, the individual's education experience applicable to the individual's job duties. The individual's compliance with fingerprint requirements, if required. Orientation and in-service education as required by the facility's policies and procedures. Okay. The individual's license or certification if the individual is required to have that. And if the individual is a behavioral health technician, documentation of the oversight that is required, that they have to be overseen by a behavioral health professional. Okay. All right. Okay. If they're required to have CPR, again, according to your policies and procedures, documentation. Okay. First aid, again, they would have to have that documentation, and evidence of freedom of TB, if they're required to. Okay. If the individual is a nutrition and feeding assistant, okay, documentation of completion of that training program, okay, and the nurse's observation that are required. You will learn if you read about the nutritional and feeding assistants. Part of the training is that the nurse watches them, observes them initially, and then every 3 months. So that would also have to be in that member's personnel record. Okay? All right. All right, an administrator shall ensure that personnel records are maintained throughout the individual's period of service in the Nursing Care Institute, and then for at least 2 years after they leave employment. Okay. Administrator shall ensure that a plan to provide orientation specific to the duties of personnel members or employee or volunteer and a student is developed, documented, and implemented. Personnel members completes orientation before providing behavioral health services or physical health services. Okay, that's a little bit of a change. Remember, orientation used to happen when? The first week of employment. So now it's before they actually provide the care. All right. Individual orientation is documented. Okay, and it includes the individual's name, the date of the orientation, subject or topics covered in the orientation. Okay. Director of Nursing develops, documents, and implements plans to provide in-service education specific to the duties of personnel members. Personnel members' in-service education is documented to include personnel's name, date of training, and again, topic, subject. All right, administrators shall designate a qualified individual, Sylvia, social services, and recreational services.
So with this, I would just like to clarify that according to the way the rule is written, this seems redundant from R910406.1 that says that the facility identifies the skills, qualification, knowledge, as policies and procedures describes all the skills. And the concern that I specifically have about this is that when we go back to qualified individual under the state statute, it refers you back to
Okay, Sylvia's concern.
baccalaureate social worker.
Sylvia's concern is regarding redundancy. The first is basically having to have the facility do the job description. That's basically just saying the job description. This one is basically saying someone has to be designated to provide the service. And Sylvia's concern is if you read back in the statute, a qualified social worker is either someone who has a baccalaureate's degree or a master's degree in social work. Okay. And if you look at the Medicare and Medicaid requirements, it is much broader. And so facilities have been meeting the Medicare and Medicaid requirements. That opens up social services position to people with other health care degrees, okay? And I know she's put that on SurveyMonkey, so if you have a question on that, please. And that has been submitted also to our, for clarification. Yes?
Is there any minimum hours required? Anywhere does it state that you have to have so many hours of social service?
Is there any hours, basically does it specify how many hours it has to have a social worker? Basically it says a full-time social worker in the rules. Okay. All right. An administrator shall ensure that at the time of the resident's admission, a registered nurse either conducts or coordinates the initial assessment of the resident to ensure their immediate needs are being met. Okay. And a resident who transfers from a nursing care institute is not required to be rescreened for TB. So basically, what does this mean? This means that if you're ABC nursing home, okay, and you're sending it to CDE nursing home, all right, the resident got their TB screening in July, okay, and they were negative. You documented it in their clinical record, all right, and you're sending them over to CDE. CDE receives it. They have documentation that it was negative. The resident is not required, nor is the facility required, to do a second screening, okay? It's due when? The next July, within 12 months. Yes, Terry.
Is it just true for a nursing care institution, or is it also true if the resident resided in an assisted living facility?
The rule says nursing care institute. So yeah, just nursing home to nursing home is what the rule says. Okay. All right. Okay. Now, these are the requirements, and we kind of went over them a little bit here for a second. Basically, if it was less than 12 months ago and documented freedom of TB in there, kind of gave you the little scenario instead of just reading this out, okay? Discharges, basically no rule changes for discharge. Okay. All right, transport and transfer, all right? This is basically regarding from one healthcare institute to another healthcare institute. I wanted to clarify that. Okay, and transport is taking them from one to another, okay? So, except for in an emergency situation, a personnel staff member coordinates the transportation, okay? And it's going to be according to the facility's policies and procedures. An evaluation of the resident is conducted before and after transport. Medical records are provided to the receiving healthcare institute, and personnel members explains the risk and benefits of the transport to the resident or the resident's representative. Okay, so if you're sending someone out to another healthcare institute to get some outpatient services, this would be required.
Can you define healthcare institution?
Healthcare institution, hospital, dialysis center actually falls into the healthcare institute. So if they're going for an outpatient surgery center, that would qualify for a healthcare institute. So if you're sending them out to, to get a PEG tube at the hospital, that would be a healthcare institute.
It says due to an emergency, so if it was a scheduled outpatient dialysis treatment, this would not apply?
If it was scheduled, yes, it would apply. It says except for transport due to an emergency.
Except for transport.
Yeah. So if it's an emergency situation and you're sending a resident to the hospital, 911, this is not required. But if you're sending them out to get a new PEG tube or a new PICC line, you're going to have them come. They're going out, they're going to receive an outpatient service, and they're going to be sent back, and it's something that's scheduled, then this is required.
What about for a doctor's appointment?
Doctor's appointments do not qualify under healthcare institutes. Now, I have been some clarification. Some doctors' offices are actually inside a hospital, and they're sending them to a PEG tube. So if they're going to get outpatient treatment, they're going to their doctors to go to the hospital. If it's actually going to be done inside the healthcare institute, so like a hospital, then yes. But if they're just going to a regular doctor's office to a regular visit, it's not considered a healthcare institute.
If they're being transferred to an assisted living, would this apply?
They're being, yes, it's another healthcare institute, but that's going to be transfer, not transport.
I understand, but it does say
Yeah.
transfer.
Well, transfer is coming up. I'll get to that one, Terry.
Okay.
Yes.
What about home clinics?
Wound clinics is another outpatient healthcare. Okay. So communication with wound clinics, dialysis center. Okay. Yes.
What is an evaluation?
An evaluation has been changed from assessment because they said, because of the statute basically says that only RNs can assess. So the evaluation would be determined by the facility on the resident's condition prior to leaving, and then on their condition when they return. And that would be documented. We're gonna get to that part in just 1 second about documentation too. Okay. Documentation in the resident's medical record includes communication with the individual at the receiving healthcare institution, date, time of transport, the mode of transportation, and if applicable, the personnel member accompanying the resident. Okay. All right. And then this is transfer. Okay. So transfer is basically what we used to say is a discharge, but it's actually transferring a resident from one healthcare institute to another healthcare institute. So that could be hospital, nursing home, assisted living, okay, but not to their own home, okay, because that would be a discharge. Make sense? Okay. So again, except in an emergency, all right, a personnel member coordinates the transfer according to the policies and procedures. All right. An evaluation of the resident is conducted before the transfer. Medical records, including orders that are effective at the time of discharge. So all those orders that are in effect at the time of discharge, okay, are provided to the receiving facility. All right. And the personnel staff member explains the risk and benefits regarding the transfer. Documentation in the resident's clinical record includes communication with the individual at the receiving healthcare institute. Excuse me. Date and time of the transfer, mode of the transfer, and again, if a personnel staff member accompanied them. Okay. All right. So that was transport and transfer. Any more questions? Nope. Okay. Resident rights. Okay. Administrators shall ensure the requirements of resident rights are conspicuously posted on the premises. All right. And at the time of admission, a resident or the resident's representative receives a copy of the written resident rights. Okay. Policies and procedures include who and when a resident or a resident's representative is, how the resident is, or the resident's representative is informed of the resident rights and where the resident rights are posted. Okay. All right. Administrators shall ensure that a resident has privacy in bathing or toileting. The change in here is it used to say ADLs, okay, and now they just switched it to bathing and toileting. Okay. A resident is treated with dignity, respect, and consideration. All right. All right. Also, rights include that a resident is not subject to abuse, neglect, exploitation, other types of abuse, including sexual or sexual assault, seclusion, restraint if not necessary, retaliation, and misappropriation of resident property. All right. A resident or the resident's representative, except in an emergency, either consents to or refuses treatment, may withdraw consent prior to the start of treatment, and except in an emergency is informed of the purpose of alternatives to psychotropic medications or surgical procedures, okay, and the risks that are associated with either one of them. Okay. All right, resident is informed of the following: the Healthcare Institute's policy on healthcare directives and the resident's complaint process. So in other words, how they are able to, and who they're able to file a complaint with. Consent to be photographed, okay? A resident, basically, if the facility uses photographs as a means for identification, okay, they can still do that before obtaining consent, all right? If you're gonna use photographs for activities or for anything like that, posting them up and all that good stuff, you have to get consent from the resident or the resident's representative. But if you're going to use them just for identification, most facilities, or a lot of facilities, take a picture of them. They either put them on the MAR or they put them for identification. You can do that prior to obtaining that consent. Okay. All right. Resident has the right for the following: not to be discriminated regarding race, a national origin, religion, gender, sexual orientation, or age, to receive treatment and supports and respect the resident's individuality, to receive referral to another healthcare institute, and to receive assistance from a family member, representative, or other individual in understanding and protecting and exercising their rights. Okay? Yes?
Okay, going back to the photographs, the way this
Yes.
reads, it says that the resident has, or the resident's representative consents to photographs, except that the resident may be photographed when admitted to a nursing care institution for identification and administrative purposes.
Correct.
So the way that reads is that they do not have to consent to that ever.
No, not for the identification.
Okay.
That's the only thing they don't have to. If a resident is going to be photographed in the facility and it is for identification only and administrative purposes only, they do not have to consent. But any other time for activities or posting on the wall or anything like that, then they would have to give consent for those.
Okay.
Okay. All right. Okay, why don't we go ahead and take about a 10-minute break right now, and when we come back, we'll start with medical records. All right, medical records. All right, basically, administrative shall ensure medical records is established, maintained according to the Arizona Revised Statute. Okay, so basically, if you're an adult, they have to keep them 6 years after you discharge. All right. We could go into the ones that are younger than adult, but I bet it'd be easier for you to actually look it up on the website, because basically, we'll go into it. Why not? We'll do a little math here. If you have a resident that's 10 years old, okay, you have to keep the medical records up until they're 18 plus 3 years. So you would maintain those records for what? 11 years, right? Okay. But if you had a resident, okay, who was 17 years old, okay, it says that you maintain them for 3 years after they turn 18, or 6 years from the date of discharge, whichever is the longest. So it would be what? 6 years, because that would be the longest. Okay? All right. All right. Medical records. All right. Specifics. Orders. Okay. Date. Okay, they must be dated, all right, entered in the resident's clinical record, and must include the time. I will tell you, when we're out in the facilities, the one thing we see missing almost all the time is the time. Okay, 99.9 have date, but usually there is no time on it. Okay, authenticated by the medical practitioner, okay, or behavioral health professional. And if the order is verbal, authenticated by the medical practitioner or behavioral health professional. Okay? Administrator shall ensure that the resident's medical record includes documentation of general consent and, if applicable, informed consent. All right? Care plans, progress notes, disposition of the resident after discharge, and discharge planning. I know we changed the verbiage here, and I just put care plans, and the actual verbiage on yours says behavioral care plans. But since behavioral care plans has been dropped, we're asking for a little clarification if it's going to change. So we included in our PowerPoint just care plans, okay? And I know in the others it did specifically say behavioral care plans also. But since there's no requirement for that anymore, we're asking for clarification if that's going to be dropped. Okay, also discharge summary, transfer documentation, and if applicable, any laboratory radiology diagnostics, okay, or documentation of restraint or seclusion, or any consultations that have been done, okay. Documentation of medications, all right. This should seem very familiar to you, okay. Now I know in the rule you have right now, it's supposed to be PRN medications, okay. Instead of, they actually left out the word PRN for the pain medications, okay. It's supposed to have PRN, is what we've been told, all right. So for pain medications, if you're Medicare or Medicaid, you're familiar with this, you have to have the evaluation of it when? Before and after, all right. Again, psychotropic medications on a PRN basis, you have to have what? Documentation of the need prior to, right? And evaluation of the effectiveness afterwards, okay? Right. If the resident has been assessed for receiving nutritional feeding assistance, documentation of the assessment and the determination of the resident's eligibility has to be in their clinical record. And if applicable, any written notices, including follow-up instructions provided to the resident or the resident's representative. Okay, and some people wanted to know some examples of that. If you're discharging a resident, you know that information that you fill out regarding their medications and home health and all that good stuff, that would be something like that would be provided and need to be copied into the medical record. So what you actually provided to them would be what? Their follow-up instructions, how to make appointments and all that good stuff. You need a copy of that. Okay. Director of Nursing shall ensure that a method is established and documented that identifies a type and numbers of personnel that are necessary to provide the nursing services to residents based on the residents' comprehensive assessment, orders for physical and behavioral health services, care plan, and the Institute's scope of services. And sufficient nursing personnel are on the Nursing Care Institute premises to meet the needs of the resident. Okay.
So,
yes.
Under the new guidelines, you're requiring the director of nurses to establish a staffing pattern based on some kind of procedure tied to acuity and or whatever tool she chooses to use, correct?
Basically, yes, the director of nursing will have to determine based on the resident's comprehensive assessment, the care plans, the orders for the health and behavioral services that are going to be provided to the resident. And then they'd have to determine not only the types of personnel, okay, that there are sufficient personnel on site to provide those cares. Okay. Okay. All right. Medical services, really no new rules. All right. And the comprehensive assessment. All right. This is going to be very familiar with you. I am not going to go through every one of these. How many of you know what an MDS is? Come on, everybody, raise your hands. Sylvia, I didn't see your hand. Thank you. All right, so everyone knows what an MDS. For all facilities that are Medicare or Medicaid certified, you guys are very familiar with MDSs. This is what this is, okay? So it basically, everything that's included in the MDS will, or if you do the MDS, you will meet all these requirements. Does that make sense? Okay. So has to be completed within what? 14 days, right? Has to be what? Either conducted or coordinated by an RN, right? Interdisciplinary team. All right, we've got those. All right. And then when do you have to do another comprehensive? No later than 12 months, basically, right? Or if there's what? Significant change in condition, correct. All right. Include identifying information, evaluation of the resident's hearing, speech, evaluation of the resident's ability to understand, recall, mental status. All right. Starting to sound familiar. Their mental health, all that goes underneath the same section. I'm not going to repeat it all. You guys are all familiar with the MDS. It's going to be a little redundant. Okay. All right. Customary routines and activities, evaluation of the resident's ability to do their ADLs. Okay. Any medical conditions that impact the resident's functional status, quality of life, and need for nursing care services. Evaluation of the resident's ability to maintain adequate nutrition, eval the resident's oral dental, and skin condition, right? Identification of any medication or treatment administered to the resident during that 7-day period. Identification of any treatments or medication ordered for the resident, and whether the restraint has been used for the resident during that evaluation period. Okay, description of the resident or the resident's representative's participation. Okay, name and title of the interdisciplinary team members who participate in the assessment. Potential rehab, potential for discharge, and is assigned and dated by the RN who conducts or coordinates it. Very familiar? A new comprehensive is not required regarding the hospitalization, so if they go out for the hospital and need to have a significant change, you wouldn't have to do it. Okay, residence comprehensive assessment is reviewed by the registered nurse at least once every 3 months. Those are your what? Quarterlies, right? All right. Okay, administrator shall ensure that, now this is care plans, okay, is developed, documented, and implemented within 7 days. Sound familiar again? Okay, of the comprehensive assessment. Is reviewed and revised based on the resident's comprehensive assessment. Okay, ensures that a resident is provided nursing care institute services that address medical conditions, behavioral health issues identified, and assess the resident and maintain the resident's highest practical well-being in accordance with the comprehensive assessment. All sounds familiar, right? All right. Behavioral health services. All right. Now, these are the services, if you check, remember we talk about your licensure when you're doing and you're telling what services you're going to be provided. If you click on their behavioral health, okay, these rules you would have to follow, okay? If you did not, these rules will not apply to you, okay? So for behavioral health services, if you identified your facility that you will be providing those services, all right? And it says, except for behavioral care. Remember we gave that definition of what behavioral care was in the beginning, all right? Has to be provided, behavioral health services have to be provided under the direction of a behavioral health professional. Yes?
Is the behavioral health professional defined somewhere?
Yes, behavioral health professional is defined, and it's right there, R910-114, and it basically talks about a psychologist and a psychiatrist. There are other individuals listed in there, and it's more specific for you. Okay? So it says, if you have behavioral health services, must be provided under the direction of the professional and in compliance with the requirement for behavioral health paraprofessionals and behavioral health technicians. And they basically have to work under the direction of a behavioral health professional. Okay? All right, and for their assessments. All right, except for psychotropic medications used as a chemical restraint or administered according to an order from a court of competent jurisdiction, informed consent is obtained regarding the use of psychotropic medications and documented in the resident's clinical record. Okay? Yes?
That piece is no different than the current federal requirement.
Sylvia says that that piece is not any different from the current federal requirement. The federal requirement does require informed consent prior to the use of psychotropic medication, and it's documented. That is correct.
Okay.
Okay. All right. If the Nursing Care Institute provides assistance in self-administration of medication to a resident receiving behavioral health services, again, this is only for behavioral health, okay? A resident's interdisciplinary team determines that the resident is capable of self-administering it, okay? And the attended attending physician documents authorization for the self-administration. The resident's medication is stored by the Nursing Care Institute. Okay. The following assistance is provided to the resident. A reminder of the time to take the medication. Okay. Opening the medication container. Observing the resident while the resident removes the medication from the container. Verifying that medication is taken as ordered by the resident's medical practitioner. Confirming, okay, that the resident taking the medication is the individual stated on the medication label. The dose on the label is the same as stated on, or the dose of medication is stated on the label, sorry, and the medication is being taken by the resident stated on the medication label. And you have to observe the resident while the resident takes the medication. Okay. Policies and procedures for assisting in self-administration of medication are reviewed and approved by a medical practitioner or a nurse. Training for personnel other than medical practitioner, nurse, or medication assistant in self-administration of medication is provided by the medical practitioner or nurse or individual trained by a medical practitioner or a nurse. Okay. Includes demonstration of the personnel member's skills and knowledge necessary to provide assistance in self-administration of medications, identification of medication errors, okay, and emergency related to medications that require emergency medical intervention, and procedures for notifying the appropriate entities when an emergency medical intervention is needed. A personnel member other than a medical practitioner or registered nurse completes the training before the personnel member provides assistance in self-administration of medications. The assistance with self-administration of medications provided to a resident is in compliance with an order, is documented in the resident's medical record. And is documented in the resident's medical record. Now, we did have concerns regarding, well, only the LPN and the RN or med tech can actually administer medications in a nursing home. So who are they going to be training? We do have this one out for clarification because a CNA, if you were going to train them, could they administer medications? No, it's outside of their scope. And so for nursing assistants who provide care and services, they would be working outside of their scope of practice. Okay? So there is some clarifications regarding the self-administration of medication and the assistance of that. Okay? Yes, Sylvia?
Kate, I'm just wondering if you can provide any further guidance on the rules regarding what behavioral health what rules facilities should be looking at if they choose to designate that they are providing behavioral health services, because the only rules that are here are three, and the first one applies to under a professional.
Mm-hmm.
The second one applies to anybody in the facility, whether they're in behavioral health services or not, because it's required that they get informed consent for any psychoactive meds. And the third one is pretty useless because there is virtually not a single patient in this state in a skilled nursing facility who needs behavioral health services who has the capacity and the ability to self-administer their own meds.
Okay.
At this level, it's a moot point. So basically, there's no guidance, there's no information about what a facility is supposed to consider behavioral health services or what rules they're to follow.
Okay, so basically you're asking about what rules for a facility, if they want to check behavioral health, what rules they would have to follow. They will have to follow all the Nursing Care Institute rules for licensing, and they would have to follow the ones for behavioral health. As Sylvia mentioned, there's only three basic rules, one about self-administration, well, one about self-administration of medication, and then there's also one about training someone for self-administration, and then regarding court-ordered medications, regarding, except for court-ordered medications, requiring them to have informed consent. And if they're a behavioral health professional, you have to work underneath the behavioral health professional if you're a paraprofessional or tech, or you have to have your whole behavioral health overseen by a behavioral health professional. Yes, those are our only rules, and those are the only ones we have right now. We do have clarification because, again, like I said, there's really no personnel other than nurse who would administer the medications, but those are the only rules that we have in effect for if you check that box on there.
What are surveyors going to be looking for?
What are surveyors going to be looking for? If you check that you did that, we would be looking to see if you did. We would, again, we'll only be looking at a sample. Everything we do is what? Sample based. We're not going to look at every one. But if you only have 1 or 2 residents in the facility receiving behavioral health services, your sample would be probably 2, right? But we will be looking at if you have any behavioral health technicians. If you do, that they're receiving services underneath the direction of a behavioral health professional, okay? We would check to see if you had anyone receiving self-administration of medications. If they are, we would then be observing them. Again, it would be a sample accordingly. For consents, we would do the same thing that we've always been, is if a resident's on psychotropic medications, we already take a sample of those consents. We'd be looking at those consents. And we would make sure that you do have a behavioral health professional overseeing your behavioral health services as of right now. Okay. Okay. All right. Okay. All right. Clinical laboratory services. All right. Now, if you checked again, like I said, about in yours, you're going to be providing clinical laboratory services are provided on the premises. Okay. Basically, it says clinical laboratory service, pathology services are provided. You basically have to have a certificate of accreditation for that. So if you're going to be a lab, you have to be accredited as a lab, okay, on there. All right. You have to provide a copy of that certificate to us, okay, upon request. All right. And a nursing care institute is available to provide clinical laboratory services delineated in the nursing care institute's scope and services when needed by the resident. Obtain specimens, clinical laboratory services, okay, without transporting the resident, and has the examination of the specimen, performed on the clinical lab. All right. Clinical laboratory tests and pathology tests, okay, are available to the ordering physician within 24 hours after the test is completed, all right, if you're doing it in-house, and within 24 hours after the test results is received if performed by an outside laboratory, okay, and documented in the resident's clinical record. All right. If the test result is obtained and indicates that a resident has an emergency medical condition as defined in the Nursing Care Institute's policy and procedures, personnel, they have to notify the ordering physician, the registered nurse assigned to the unit, and the Nursing Care Institute's administrator or director of nursing. Okay. If the clinical laboratory report is completed on the resident, a copy of the report is included in the resident's medical record. Okay. If the Nursing Care Institute provides blood or blood products, okay, you have to have policies and procedures in place regarding procuring, storing, transfusion. Yes.
I'm sorry, but going back just a bit, if
yes.
there is a indication that there is an emergency medical condition, personnel is supposed to notify the registered nurse in the residence assigned unit.
Correct.
But the requirement is not, we don't have to have a registered nurse on 24 hours a day, 7 days a week. So who would we notify?
Basically, the question is there's no requirement that a registered nurse be in the Nursing Care Institute 24 hours a day. So who would they notify? It says the registered nurse in the residence assigned unit. It doesn't specify whether they have to be there or not, and we have clarification out there requesting if they have to call the unit manager or if this is going to actually be removed for that. So we do have some clarification because we wanted to know, does this mean a registered nurse that is actually in the building over the units, or is this someone like in charge of it where some facilities have unit managers and they would have to be notified?
That may not be a registered nurse.
Right. Whatever, we've got some little clarification for that, for whoever it is, because they may have a director of nursing or an ADON, and I know it says DON afterwards, but we have several facilities that have ADONs over certain parts of the building. So we've kind of asked for a little bit of clarification for that, because they also said, like you said, we don't have an RN 24 hours a day, 7 days a week, and you can get lab results faxed to you at all different hours of the day and night. Did they have to physically be on site for that? So we do have that out for a little bit of clarification also. Okay. Okay. All right. We're talking about blood products. Okay, so if you're going to transfuse blood or blood products, you have to have, again, policies and procedures regarding procuring, storing, transfusing, blood typing, antibody detection, investigating transfusion adverse reactions. Okay. The question was they didn't think they could give blood. Now the new rules say that you can give blood. You just would have to have all this in place. And again, remember, training and everything else would have to be in place too if you were going to be transfusing. Okay. All right. Again, any expired laboratory supplies are discarded according to the facility's policy and procedure. Okay. All right. Dialysis services. If dialysis are being provided on the premises, an administrator shall ensure that the dialysis services are provided in compliance with their requirements. Okay. Remember, you're going to check if you're having dialysis performed. If you have an outside company that's coming in and they have a certain section in your building that they provide dialysis on, you still will be checking that because it'll still be something that is done inside your building. Okay? All right. Radiology and diagnostic imaging. Okay? So if you're going to provide radiology service and diagnostic imaging services on the premise of the Nursing Care Institute, the administrator shall ensure that those services are in compliance with their requirements. Okay? And guess what you're going to have to provide to us? A copy of their certificate saying that they are in compliance. Okay? Has to be maintained. All right? When needed by a resident, radiology services and diagnostic services delineated in the Nursing Care Institute scope and services are provided to a resident, okay, on the premises, okay? Radiology and diagnostic service imaging are provided under the direction of a physician, okay, according to an order, and includes the resident's name, the ordering individual, the test that is actually ordered, and the reason for the procedure. The medical director, attending physician, or radiologist interprets the radiologic or diagnostic image. The radiologic or diagnostic image report is prepared and includes, again, the resident's name, date of the procedure, the person who interpreted the imaging, the type and amount of radiopharmacological used, and any adverse reactions to the radiopharmacological. Okay? Now everyone say that 10 times really fast. No? All right. Okay. And a radiologic or diagnostic imaging report is included in the resident's clinical record. Okay. All right. Respiratory care. Okay. If you are providing respiratory care, Services are provided on the premises. Okay. Administrator shall ensure that respiratory services are provided under the direction of the medical director or the resident's attending physician. Okay. Order includes resident's name, signature of the ordering individual, type and frequency of the treatment and duration if applicable. Okay. Type and dose of medication and diluent, oxygen concentration, oxygen liter flow, and method of administration. Respiratory care and services provided to a resident are documented in the resident's clinical record. Date and time of administration, type of respiratory services, effect of the respiratory services, any adverse reactions, okay, and authenticated by the individual providing the services. All right, any area or unit that performs blood gases, basically, our clinical laboratory test complies again with the requirement for the clinical labs. Okay. All right. Rehab services. Okay. If the facility is going to be providing rehab services, administrator shall ensure that it's under the direction of an individual qualified according to their policies and procedures, by an individual licensed to provide the rehab services, and according to an order. The medical record of the resident receiving rehab services must include an order for the rehab services, documented care plan that is developed and coordinated with the ordering individual, the rehab services provided, the resident's response to the rehab services, and authenticated by the individual providing the rehab services. Okay. Okay. Medication services. Policies and procedures include a process for providing information to a resident about medication prescribed to the resident, including the prescribed medication's anticipated results, the prescribed medication's potential adverse reactions and potential side effects, potential adverse reactions that could result from not taking the medication. Now, we have had several questions. Does the nurse have to do this every time? There's nothing in here that says that the nurse has to do that every time they do the medication. Some facilities have asked us if they are able to review all the medications that are ordered with them and go over all this on admission, and then with any new medication order, review that with the resident. There's no rule that says that is not a way you know that you're not allowed to do that. Okay? It just says all this must be done. Okay? So whatever way you do it, make sure your policy reflects the way you're going to be implementing this. But again, there is no requirement that the nurse administering the medications has to do this every time. Okay? All right. Procedures for preventing, responding to, and reporting med errors, adverse reactions, and medication overdoses. Okay. Procedures to ensure the pharmacy reviews the resident's medication at least every 3 months. Again, I caution you how often, if you're a Medicare or Medicaid facility, still meet those monthly, still meet those requirements. Okay. All right. All right, and then it just again about the documentation to the attending physician, the director of nursing, indicating any potential medication problems. Okay. Procedures for documenting medication services and assistance with self-administration of medication. Procedures for assisting a resident in obtaining medication, and specify a process for reviewing through the QA any medication errors or adverse medication reactions. Okay. All right. Policy and procedures for medication are reviewed and approved by the director of nursing. All right. Specify the individual who may order medications and administer medications. Ensure the medication is administered to a resident only as prescribed. And a resident's refusal to take medication is documented in the resident's medical record. Verbal orders of medication received are taken by a registered nurse unless otherwise provided by law. And medication,
Registered nurse?
pardon me? By nurse.
Okay, you said registered.
Oh, I'm sorry, I misspoke. It was supposed to be by nurse. Okay. A medication administered to a resident is administered in compliance with an order and is documented in the resident's medical record. Okay. If a psychotropic medication is administered to a resident, this is going to seem very familiar to you, okay? Although there really are no time frames put into here, it will seem familiar. Only administered to a resident with a medical condition, right? And unless clinically contraindicated or otherwise ordered by an attending physician, is gradually reduced in dose while a resident is simultaneously provided with interventions such as behavioral and environmental modification in an effort to discontinue the psychotropic medication. Unless a dose reduction is attempted and the resident displays behavioral justification, the need for the psychotropic medication, and the attendant physician documents the necessary for the continued use of the dose. Okay? All right, medication services. Current drug reference guide is available for personnel. And if pharmacy services are provided, basically they have to be in compliance with the requirements of a pharmacy, and a copy of the license is provided to us upon request. Okay? So if the Nursing Care Institute is going to provide pharmacy services, just like a regular pharmacy. All right. When medication is stored at a Nursing Care Institute, there's a separate room, closet, or self-contained unit used for medication storages that includes a lockable door. If medication is stored in a room or closet, a locked cabinet is used for medication storage. And medication is stored according to the instructions on the medication container. So basically, if it has to be refrigerated, it has to be refrigerated. It has to be maintained at a certain temperature. It's going to have to be maintained at a certain temperature. Okay. All right. Policy and procedures established regarding receiving, storing, inventorying, tracking, dispensing, and discarding medications, okay, including expired medications. Discarding or returning packaged and sample medications to manufacturer. A medication recall and notification of residents who receive the recalled medication. And storing, inventorying, and dispensing of controlled substances. I will tell you that we are looking at that a lot closer than what we had in the past. I can't tell you how many accounts of drug diversion we have gotten called into our office recently, but it is huge, okay? I'm talking at least a couple a month, at least, if not more, all right? So we are looking about how facilities are receiving those medications, how they're actually tracking those medications and the quantity of them, okay? A lot closer than we used to. Okay. An administrator shall ensure that a personnel member immediately reports a medication error or resident's adverse reaction to the medication to the medical practitioner who ordered the medication and the Nursing Care Institute's DON. Okay. All right. Infection control. All right. An infection control program is established under the direction of an individual qualified according to, again, your facility's policy and procedures. Okay, to prevent the development and transmission of infections and communicable disease. A method to identify and document infections occurring in the Nursing Care Institute. Analyzing the types, causes, and spread of infection and communicable disease at the Nursing Care Institute. Development of corrective measures to minimize or prevent the spread of infection and communicable disease at a Nursing Care Institute. Kind of sound familiar, guys? Okay. Documentation of infection control activities, including the collection and analysis of infection control data, the action taken related to infections and communicable disease, reporting of the communicable diseases to the governing authority and to the state, county health departments. Infection control documentation is maintained for at least 12 months. Okay? after the date of the documentation. Right?
This document still says 2 years.
Okay, that's a little bit different than the version I have. Still says 2 years. The most recent version that I got does say 12 months. So we didn't update that or change it. I will double check with them if it's going to be 2 years for infection control. Okay, or 12 months. So I'll add that to our clarification for because if the document still says 2 years, then the one I was provided says 12 months. I'll ask for a little clarification and we'll get that up on the website as a clarification for it. Okay. Just remember though, if our window is for our sites up to 15.9 months, and we usually survey between that, and we would want to see that documentation. Yes?
Is there a clarification on what is considered to be a communicable disease?
It's
like, for example, flu?
Well, it's actually, you actually have that. There's actually a whole list of what has to be reported. So if you go in there and check what's required for you to be reporting, there's a whole list of stuff that's required to be reported. Okay? Okay. Policies and procedures are established in compliance with the requirement at, and this is where you want to look at, okay, 9 AAC 6, for reporting and control measures for communicable diseases and infestations, handling and disposing of biological medical waste, and sterilization, disinfection, and storing of medical equipment and supplies. Okay. Use of personal protective equipment such as aprons, gloves, gowns, masks. Okay. Cleaning of individuals' hands when the individual's hands are visibly soiled before and after providing services to the resident. And training of personnel, employees, and volunteers in infection control practices. Biohazardous medical waste is identified, stored, and disposed according to the requirements. Maintained separate from clean linen and clothing and away from food storage and kitchen. Administrators shall ensure compliance with contagious disease reporting and requirements. Again, there's another area for you to look at. And communicable disease reporting requirements. Okay. For food services, an administrator shall ensure if a nursing care institute contracts with a food establishment as defined in Article 1 to prepare and deliver food. Nursing Care Institution has a copy of the contract. Nursing Care Institute is able to store, refrigerate, reheat food to meet the residents' dietary needs. A registered dietitian reviews the menu before the menu is used, documents the review of the menu, and is available for consulting regarding a resident's nutritional needs. A registered dietitian or director of food services shall ensure that the food menu is prepared at least a week in advance, includes the food to be served that day, is conspicuously posted at least 1 day before the first meal, includes any food substitutions no later than the morning of the day the meal was to be served. And we did have some questions regarding that one. What if they said that they were going to go to their pantry and get a can of green beans and they noticed that it was dent or bulging and so they can't serve that? Would we actually cite them because that was not there and they would not have known that because they had it on site? Again, you know, think about it. If you were going to provide it and you just found out, you would have to show the surveyor that information. And it should go as technical assistance to tell you that, you know, you should if you were going to know that. But if your building was supposed to provide roast beef and you only have chicken and you knew that for 2 days in advance, would you be, would that possibly be a deficient practice? Yes, it would, because the facility should have known that. Does that make sense? Okay. Alrighty. And is maintained for at least 60 calendar days after the last day. Okay. All right. Now, this I know is there's a lot of controversy out there. We've had a lot of the registered dietitians submit us some meal plans because the one that's actually listed up there is basically for reimbursable food meals, and we know that it doesn't meet the caloric needs, nor does it meet the protein needs of the residents. It doesn't require protein at breakfast, and it only requires 4 ounces of protein for the whole day. Okay, so we've already been told, and it requires what, non-fat milk or 1% milk to be served with that. So they have actually submitted several of their areas or defined areas that would actually meet the needs of residents in a nursing home. We have submitted them to the Rules Committee. They are reviewing them, and they will get back with us, okay? So just remember, you have to meet the residents' nutritional needs. Are we going to go in there to see that you provided a cup or 2 cups of the vegetables right now? No, because we're going to provide technical assistance. If you've assessed the resident, determined what the resident's nutritional needs are, and are being met by that, then we will be continuing to provide technical service until we get clarification. Does that make sense? Okay. All right. Tableware, utensils, equipment, and food contact services are clean and in good repair. Water is available and accessible to the residents. If a nursing care institute has a nutrition and feeding assistants, an administrator shall ensure they're at least 16 years of age. If applicable, are met the requirements for fingerprint clearance. Completes a nutrition and feeding assistance training program within the last 12 months. Okay. Provides nutritional and feeding assistance where nursing personnel are present. Immediate reports an emergency to a nurse, or if the nurse is not present in the common area, to nursing personnel. If the nutrition and feeding assistance observes a change in the resident's physical condition or behavior, reports the changes to the nurse. Okay. A resident is not eligible, okay, to receive nutrition and feeding assistance from a nutrition and feeding assistant if the resident has any difficulty swallowing, okay, any recurrent lung aspirations, receiving enteral or parenteral nutrition, okay, has any other eating or drinking difficulty that may cause a risk to the resident's health and safety. Okay. Only an eligible resident receives nutrition and feeding assistance from a nutrition and feeding assistant. A nurse's document if a resident is eligible to receive the nutrition and feeding assistance. And it's got to be based on the resident's comprehensive assessment, the resident's care plan, and assessment conducted by the nurse making the determination. Okay. A method is implemented that identifies eligible residents, that ensures only eligible residents will receive the assistance. And when a nutrition feeding assistant initially provides nutrition and feeding assistance, and at least once every 3 months, a nurse observes the nutrition and feeding assistant while the nutrition and feeding assistant is providing nutrition and feeding assistance. Now, it's not a mouthful. To ensure that the nutrition and feeding assistance is providing nutrition and feeding assistance appropriately. So basically, the nurse has to observe when the nutritional feeding assistant is actually going through training. They have to observe them initially, and then every 3 months. Okay. We're also going to be talking about, and if they've identified, they have to document their observations. Okay. And then if they, it says nutritional feeding assistance provided additional training according to the facility's policy procedures. So if you decided you want them trained a little further above and beyond what the requirement is, you include that in your policy and procedures. And if the nurse, when they're making those observations, if they determine that the resident requires any kind of other guidance, that they provide that and it's documented. Okay. All right. Emergency and safety standards. A disaster plan. Okay. Now, this is a little bit different than what you're used to. We're going to discuss a little bit about a plan, and then we're going to discuss about the drill. This is only the disaster plan and not the disaster drill, okay? So the disaster plan is developed, documented, and maintained in a location accessible to personnel members and other employees, and if necessary, implemented. It includes when and how residents will be relocated, including instructions for evacuation, transfer, assigning responsibility for each employee and personnel member, a plan to continue to provide services to meet the residents' needs, how a resident's medical record will be available, a plan to ensure residents' medication will be available, okay? A plan to ensure the resident is provided nursing services and other services required, a plan to obtain food and water for the individual. The disaster plan is reviewed at least once every 12 months. Documentation of the disaster plan review is maintained for at least 12 months. The date and time of the disaster plan review, it must include, the date and time of the disaster plan review, name of each personnel member, employee, or volunteer participating in the review, a critique of the review, and if applicable, any recommendations for improvement. Again, this is just for the plan. Okay. All right, now we're going to talk about drills. Documentation of each drill is created, is maintained for at least 12 months after the date of the drill. It includes date and time of drill, where the drill was for, whether the drill was for employees only or it included the residents. Okay. Yes?
Okay, does the same rule apply when you're using 12 months here? Because if the survey window is 15 months and the disaster drill falls outside that time frame, are you still going to be looking at that?
The federal requirement is periodically.
Okay.
So we would be looking to see if you trained your staff periodically. The disaster drills by the state is a little more stringent, and it requires what? Every 6 months. So that would be a little bit more stringent. So if you had documentation that you periodically trained your staff, that would be sufficient for federal. Okay. All right. If applicable, the amount of time taken for employees and residents to evacuate, identification of residents needing assistance to evacuate, identification for residents who were not evacuated, and any problems encountered in conducting the drill, and recommendations for improvement if applicable. All right, an evacuation path is conspicuously posted on each hallway of each floor of the Nursing Care Institute. Okay. All right. They also shall ensure that they obtain a fire inspection conducted according to the timeframes established by your local fire department or state fire marshal. Okay. Some actually are doing it how often now, guys? Every 2 years.
2 years.
Okay. So if it's required every 2 years, then we will ask that. We will also ask that you maintain that copy, even if you provide us the second, for a second year, because it's been, they just came in the first, and next time we're in, we still will ask for it, all right? But you just have to be in compliance with whatever your local requirement is, all right? Make any repairs or corrections stated on the fire inspection and maintain the documentation of the most current. We kind of talked about that. All right, environmental services, pest control program is implemented and documented. People have asked, what is documentation of a pest service? Well, you know what? If you get those receipts, most facilities receive a receipt of that. Is that documentation that it was done? Sure. So just keep your receipts. Okay. Equipment used to provide direct care. Now this is a little bit different. It says tested and calibrated according to the manufacturer's recommendation. Okay. Or if there are no manufacturer's recommendations, as specified in accordance with your policies and procedures. Remember, that is if there are no manufacturer's instructions. Okay. All right. Heating and cooling. Just a little bit of a change, okay? Now it says temperatures must be between 70 and 84. It used to be what? 71? Yeah. Okay, common areas are lighted to ensure safety of the resident, have enough lighting to allow personnel members to monitor resident activities. The supply of hot and cold water is sufficient to meet the personal hygiene needs of the residents and cleaning and sanitation, okay, as required. Okay. Oxygen containers are secured in an upright position, and poisonous or toxic materials stored by a nursing care institute are maintained in a labeled container in a locked area separate from food preparation and storing, dining, medications inaccessible to the residents. Combustible or flammable liquids stored by the Nursing Care Institute are stored in the original labeled containers or safety containers in a locked area outside the Nursing Care Institute and inaccessible to the resident. All right. If pets or animals are allowed in the Nursing Care Institute, okay, they are controlled to prevent endangerment of the resident and to maintain sanitation. License consistent with local ordinance, and they have to have both, rabies, dogs and cats, vaccination.
Visiting as well.
Well, it basically just says if they're allowed in the Nursing Care Institute, so it doesn't say it has to be the Nursing Care Institute's animal. Okay.
Can I ask a question about combustible?
Sure. Sure.
Which is number 12, combustible. Does that mean oxygen tanks? Stored in a locked area?
Oxygen would be combustible.
Locked outside the nursing institution?
You know, I would have to ask clarification. You're the first person that's brought that up. But oxygen would be considered a combustible. So I will have to ask for clarification on that one. I'm sorry, I don't have an answer for that one.
It talks about combustible or flammable liquids, and oxygen is a gas.
Well, also there are liquid oxygen tanks.
Well, if you have that would
Right.
probably be.
Yeah. So I didn't think about that, because I know there's a lot of facilities that still have the liquid oxygen. So I will have to ask. Okay, 1 second. Let me just write that down. Okay. All right. Water sources. All right. If the water is not regulated under the Department of Environmental Quality, water source is tested at least once every 12 months for a total chloroform bacteria and fecal chloroform or E. coli. If necessary, corrective actions taken. And documentation of the test is maintained for at least 12 months. If a non-municipal sewer system is used, sewer system is in working order and maintained according to the applicable state laws and rules regarding that. All right, smoking. Smoking and the use of tobacco products may be permitted outside a nursing care institute if signs designating smoking area are conspicuously posted and smoking is prohibited in areas where combustible materials are stored or in use. Okay. All right, physical plant standards. Applicable physical plant health and safety codes and standards are in effect on the date. So if basically you're doing any type of initial, okay, so if you're wanting to open up a new nursing care institute, you have to meet all the requirement plant standards for that when you're applying for it, okay? I will let you know we have a lot of buildings that have been doing remodeling, okay? And meet with the architects if you're going to do that, because they will tell you what you have to be in compliance with then, all right? So just a little guidance. If you're going to open a new one, you have to be you have to meet the regulations for everything that's applicable at that time. If you're remodeling, please submit that information in, and the architects will let you know what's required at that time for whatever construction, okay? All right, if you have a swimming pool, okay? Swimming pool is enclosed by wall or fences and no vertical openings greater than 4 inches across. No horizontal openings except as described. No chain link, and do not have a space between the ground and the bottom fence rail that exceeds 4 inches in height. Okay. Okay. Have a self-closing or self-latching gate that opens away from the pool. Has a latch located at least 5 feet above the ground and is locked when the swimming pool is not in use. A life preserver or a shepherd's hook is available and accessible. And administrators shall ensure that a spa that is not enclosed in a wall or fence is covered and locked when not in use. Okay. All right, so those are our Article 4. All right, so a little bit about Article 1, and we kind of talked a little bit about that. All right, Article 1 is basically the general rules, all right, that go over all healthcare institutes, all right, and basically they revamped those two because they basically wanted to integrate physical and behavioral health, regulatory consistency, and a focus on health and safety, okay. All right, and basically I kind of already told you, it basically includes most of the definitions for the Nursing Care Institute. So when you were before used to looking at our Article 9 for your definitions, only a few will be in Article 4. Most of them will be in Article 1, okay? And so like for definitions for abuse, okay, and I'm not going to go into this. Most people are familiar with the definition of abuse. The definition for abuse now is the same for the nursing home and for like assisted living. It's the same, okay? Where it was a little bit different, all right? And that's just one of the rules. And then basically that was definition. And then one of the rules, TB. So the TB screening again is the same for nursing home as it is for assisted living, okay? The only thing that was a little bit different again is what we included in Article 4, okay? Regarding the 8-hour contact. Okay. Yes.
So my understanding is previously they allowed for a statement in the absence, because right now there's a nationwide shortage of
Okay, because of the nation, yes. They were allowing a statement because of the nationwide shortage.
Well,
yes.
The previous regulations did, and it looks like these do not.
There is, this goes on, and there is regarding a statement if they were cleared from a provider, there is documentation of that. Hold on one second and I will find it for you. But I know.
It says if they've had a positive skin test or other screening, then
Right.
you can use a written statement.
Right, and I know that our Kara Chris, the director, had basically said because of the shortage right now, that they were allowed to provide the documentation for that until it was over, and they said it would be over shortly. I thought it was already.
We've been doing that for our employees.
Yeah.
Right now,
Yes, and they said to also you could contact Maricopa County just to find out, to verify when it would be available too. But they did say the written statement could be in a place until facilities are able to get that. So yeah, that has not changed. Okay. Any other questions? All right, thank you. And please provide those comment cards. We really need those, okay?